Hi everybody, and welcome to our module on Klinefelter and Turner syndromes. Klinefelter and Turner syndrome are sex chromosome aneuploidy disorders. This means these are genetic disorders where the affected individual has an abnormal number of sex chromosomes. Klinefelter syndrome occurs in males who have an extra X chromosome. For example, they may be XXY when they should be simply XY. Turner syndrome occurs in females who are missing an X chromosome, so instead of being XX, they are referred to as X0, meaning they only have a single X chromosome. Both of these disorders can be diagnosed by sending a patient for a test known as a karyotype. A karyotype involves counting the number of chromosomes. This is a picture of a karyogram shown on the screen here. And in patients who have Klinefelter or Turner syndrome, you will either see an extra copy of the sex chromosomes or only a single copy of the X chromosomes, and often multiple cells are analyzed for the numbers of chromosomes because, as we will see, some patients with these disorders display mosaicism, meaning not all the cells in their body have abnormal numbers of sex chromosomes. Let's start by talking about Klinefelter syndrome. In 80% of cases, Klinefelter syndrome occurs in boys who are 47XXY. This means they have 47 chromosomes instead of the usual 46. They have X and Y just like normal boys should, but then they have an extra X chromosome. And this is usually the result of meiotic non-disjunction of either parent. I talk about how this occurs in the video on meiosis. Rarely these boys are 48XXY, meaning they have two extra X chromosomes. These tend to be more severe cases because they have another X chromosome in addition to the one extra that most cases of Klinefelter syndrome have. And then sometimes boys with Klinefelter syndrome display what's known as mosaicism, which I talk about in other videos. In mosaicism, some cells in the body have different numbers of chromosomes compared with others. In this case, some cells in the body are normal, in other words, they are 46XY with just one X and one Y chromosome, whereas other cells are 47XXY and are abnormal. These tend to be less severe cases because some cells in the body have the normal complement of sex chromosomes. And these cases of mosaicism are not due to meiosis errors, they're usually due to mitosis errors. They occur due to non-disjunction during mitosis after conception. And the same thing is true in other genetic disorders where there is mosaicism. This can occur in Down syndrome, where mosaicism is due to mitosis errors and not meiotic errors. This is a karyogram of a patient with Klinefelter syndrome. You can see that there are two copies of all the numbered chromosomes, and then there are also two copies of the X chromosome and one copy of the Y chromosome. Thus, this patient has 47 chromosomes and 3 sex chromosomes with an extra X. An easy way to remember the features of Klinefelter syndrome is to think of it as a feminized male. The patients who have this disorder have an X and a Y chromosome, so they are male in appearance. However, because of the extra X chromosome, they have many female features. So one of these features is that they are going to display hypogonadism. Their testes are going to be underactive because of that extra X chromosome. They have small, firm testes. They have atrophy of the seminiferous tubules. They typically have low testosterone levels, and we'll talk more about this in a minute. And it is the ratio of estrogens to testosterones that determines the disease severity. Individuals that have two extra X chromosomes have lots of estrogens relative to testosterone, and they have more severity of their disorder. Because the testes are hypoactive, the levels of gonadotropins coming from the pituitary gland will increase. So there will be low levels of inhibin B coming from the testes. This will lead to high levels of FSH from the pituitary. There will be low testosterone from the testes. This will lead to high levels of LH coming from the pituitary. Here's a slide from our endocrinology video on male reproductive hormones, just to remind you that in the testes you can find Leydig cells and Sertoli cells, and they make testosterone and inhibin, which feed back negatively on the pituitary gland. So in Klinefelter syndrome, when you have lower levels of testosterone and lower levels of inhibin because the testes are underactive, this leads to loss of negative feedback, and thus the levels of LH and FSH can rise. Low testosterone and relative excess of estrogen account for many of the clinical features of Klinefelter syndrome. Boys with this disorder display delayed puberty, and in fact this disorder is often first diagnosed at puberty because prior to that point the children will appear to be a normal male. These boys have reduced facial and body hair. They often have a female pubic hair pattern, as is shown in this picture on the screen here. They can develop gynecomastia, and in addition, they often have infertility and reduced sperm counts. Genital anomalies are common in boys with Klinefelter syndrome. First of all, they often have cryptorchidism, which is undescended testes. In addition, they often have hypospadia. Hypospadia is where the opening of the urethra is not in the normal position at the head of the penis. Shown on the screen are a couple examples of different types of hypospadia. And then finally, boys with Klinefelter syndrome often have a very small penis. This is called micropenis. Patients with Klinefelter syndrome have a characteristic physical appearance. First of all, they usually have long legs and long arms. If you look at this picture on the screen, this is a picture of a man with Klinefelter syndrome. You can see that he is tall because he has long legs and he also has long arms. And this happens to Klinefelter patients because they have an extra copy of a gene called the SHOX gene found on the X chromosome, and this gene is important for long bone growth. Patients with Klinefelter are also said to have what's known as a unicoid body shape. A unicoid body shape means a body shape that is lacking in sexual differentiation between male and female. It's sort of an in-between body shape. And you can see that if you look at this man on the screen here, he's lacking the usual broad shoulders that men have, and he's got a body shape that is sort of in between the male and female body shape. Patients with Klinefelter syndrome can display cognitive findings. They sometimes have learning disabilities like delayed speech and language development. They also often have a quiet personality, meaning that they are relatively quiet individuals and not very assertive. For the USMLE Step 1 exam, it's high yield to know that patients with Klinefelter syndrome can have a bar body found in the nucleus of their cells. A bar body is an inactivated X chromosome. It's normally found only in the cells of females. Females are XX, so one of their X chromosomes undergoes a process called lyonization, where that X chromosome becomes condensed into heterochromatin with methylated DNA, and thus it becomes inactive, so that in each cell of a female's body only one X chromosome is active, the other one is inactive and appears as a bar body, which I've shown on the screen here. It's a dark spot at the periphery of the nucleus, and it indicates an inactive X chromosome. In patients with Klinefelter syndrome, you can also see a bar body, and normally you do not see this in males, but you will see it in males who have Klinefelter syndrome because they have that extra X chromosome. In contrast to Klinefelter syndrome, in Turner syndrome there is a missing sex chromosome. 45% of cases occur in girls who are 45X0. This means they have 45 chromosomes instead of the usual 46, and they only have a single sex chromosome, an X chromosome. They are missing the second copy of their X chromosome. Most of these cases are caused by fertilization of an egg with a sperm that lacks the X chromosome. Many cases of Turner syndrome are what's known as mosaic Turner syndrome. These are often milder cases. In these cases, girls are born with a mosaic of chromosomes in their body. So some cells will be 45X, but other cells will be normal and will be 46XX. This version of Turner syndrome, mosaic Turner syndrome, is caused by mitotic non-disjunction during the postzygotic cell division stage, and this is common to many genetic disorders. Mosaic Down syndrome is caused by mitotic non-disjunction, mosaic Klinefelter syndrome is caused by mitotic non-disjunction, and so is mosaic Turner syndrome. We saw before that Klinefelter syndrome is a male who is very tall. In contrast, Turner syndrome will be a female who is very short, and this is because girls with Turner syndrome have lost one copy of that SHOX gene on the X chromosome we mentioned earlier. And because females with Turner syndrome are often short, they are often administered growth hormone in childhood to try to have them develop to a normal height. Other classic features of Turner syndrome include a broad chest. This is sometimes described as a shield chest because the chest looks sort of square like a shield would in medieval times. And in addition, they often have widely spaced nipples, so they'll have the shield chest with the nipples very far apart on the chest. There are a couple of features of Turner syndrome that are believed to result from lymphatic obstruction that occurs during fetal development. Girls with Turner syndrome classically have a webbed neck, as shown in this picture on the right side of the screen. This is believed to result from poor lymphatic flow during fetal development. In addition, babies with Turner syndrome often have swollen hands and feet, especially right at the time of birth. Some girls with Turner syndrome have an anomaly called a cystic hygroma. This is a congenital lymphatic defect. There's a picture of one shown in this child on the screen here. It's a large collection of lymph and cysts. That's why it's called a cystic hygroma. It's often found in the head and neck, and it is sometimes detected in utero on fetal ultrasound. Ovarian function is typically abnormal in girls with Turner syndrome. The hallmark of the disorder is a female with primary hypogonadism. These girls have loss of ovarian function. It's often described as gonadal dysgenesis. In addition, a classic finding is what's known as streak ovaries. This is where there are streaks of fibrous tissue seen in the expected location of the ovaries, and these girls have no or very few follicles. Shown on the screen is a picture of the ovary. It's normally found in the middle of the broad ligament, but in girls with Turner syndrome, Instead of ovarian tissue, there will be streaks of fibrous tissue, hence the name streak ovaries. Because the ovaries are abnormal, there are decreased levels of inhibin B and estrogens to feed back on the pituitary gland, and therefore you can see increased levels of LH and FSH, just like we talked about in Klinefelter syndrome. In actual practice, it turns out that the levels of LH and FSH vary during childhood. They are sometimes normal during certain periods of development, therefore you can't rely on these for diagnosis. They're often most abnormal in early childhood and pre-puberty after 10 years of age. If this disorder isn't picked up early because of presence of a webbed neck or puffy feet or a cystic hygroma, it's often diagnosed at the time of puberty. Girls with Turner syndrome will display delayed puberty. They will have absence of breast development and failure to menstruate. This is sometimes treated with estrogen supplementation to try and induce normal changes of puberty in girls who have this disorder. In addition, Turner syndrome typically leads to primary amenorrhea. In fact, it is the most common cause. This is sometimes referred to in textbooks as menopause before menarche. Basically, these girls are born with insufficient ovarian tissue, so they have menopause before they've had the start of menses. Now, some girls will menstruate and develop menopause early in their teens or 20s. These are usually girls with the milder form, the mosaic form of Turner syndrome. Most women with Turner syndrome are infertile. As I mentioned before, they are born with 0 or relatively few ovarian follicles. Some women can become pregnant if they use donated oocytes because they can carry the baby to term once the egg has been fertilized. It's very high yield for step 1 to know the cardiovascular complications of Turner syndrome, which I've listed on this slide. About a third of girls born with Turner syndrome have a bicuspid aortic valve. Normally, the aortic valve has 3 cusps, but in about 30% of girls with Turner syndrome, it has 2 cusps, as shown in this picture on the screen. Up to 10% of girls with Turner syndrome have coarctation of the aorta, as shown in this picture here. I discussed this in detail in the cardiology section in the video on congenital heart defects. And then finally, high blood pressure is common in girls with Turner syndrome. It may even occur in childhood. It is sometimes due to the coarctation of the aorta or renal disease, which we'll talk about in a minute. However, it's often a primary disorder. Kidney malformations affect about a third of children with Turner syndrome. Often it is an abnormality of the collecting ducts. However, children with Turner syndrome can also develop a horseshoe kidney, which is something they like to test on step 1 of the boards. This is a horseshoe kidney shown on the screen here. The lower poles of both kidneys are fused, and for this reason, the fused horseshoe kidney sits lower in the pelvis. I talk about horseshoe kidney in the renal section in the video on embryology. There's a high incidence of osteoporosis in women with Turner syndrome. This is because there are low levels of circulating estrogens because of the single X chromosome, and for this reason, estrogen treatments are often prescribed in order to increase the bone density. And then finally, women with Turner syndrome often have endocrine disorders. Type 2 diabetes is more common than in the general population, and about a third of women with Turner syndrome have some form of thyroid disease. It's usually hypothyroidism from Hashimoto's thyroiditis. And that concludes our video on Klinefelter and Turner syndromes.